Now a little bit more on the multifidus muscles. Remember I said that if you contract both the transverse abdominis and the pelvic floor, they'll automatically be enlisted anyway. I'd like to take you a step further. The lumbar vertebrae are stacked on top of each other in a nice C-shaped curve here like this. I'd like you to pick a lower vertebra here, and what we're going to try and do is imagine, by contracting those muscles, imagine that we're going to choose this vertebra and by itself move it 1.5 inches forwards towards your stomach. So we're going to try and suck the one vertebra this way, and I'll just show you that in close up in a moment. But sucking both, that'll engage both this transverse abdominis, the pelvic floor, and trying to suck one vertebra through there. In a moment I'm going to show you a close up, but just to give you an idea, try doing that to the vertebra way up here. Try and suck this vertebra through 1.5 inches towards the front and as isolated from this one down here. So you'll notice that you'll use different muscles to achieve that, because the multifidus has that unique ability to stabilise only 1 or 2 segments, so you can actually achieve this. You will not be able to move it at 1.5 inches, but it's the imaginary process that will give you the desired effect. So we select a vertebra, say this one just here, and we want to suck that vertebra forwards this way towards the abdomen 1.5 inches. It's an imaginary thing, and just try and suck that vertebra forwards, and that'll also cause these transverse abdominis to kick in as well and suck in, and try and isolate it to just that level. After 6 seconds, relax and then move up to this a much higher level up here, just to give you an idea of how it works, and try and draw that vertebra forwards like this, and you'll notice that you're using different muscles for this vertebra in isolating it, drawing it 1.5 inches forwards towards your abdomen than you did when you did this one. Once you get the sense that you can isolate these, the real trick is in selecting the lowest one, which we've done, and then moving up one segment here and draw that vertebra in selectively, as opposed to this one here or this one here. And then you move up one more time and do this third lowest vertebra here and suck that one in all the time, isolating each level. So it's an imaginary 1.5 inches. You move each level through independently for 6 seconds. Well, just recapping on the multifidus exercise, we're imagining to pull those vertebrae through. We want to do this lowest one, start there, pull it through 1.5 inches imaginary, then relax, pull the next one in 1.5 inches, relax, that's for 6 seconds of course, and then go up to the third vertebra and pull that in for 1.5 inches for 6 seconds as well. Once you've done that, you can continue up and do 2 more of the whole lumbar vertebra, or if you just want to do those lower 3, which is probably the most common, just go back to the lowest again, do it again for 6 seconds, relax, the second lowest again for 6 seconds, relax, and the third lowest again for 6 seconds and relax. And then you can move on to another exercise or enjoy your day.